First thing is to make sure that I have all my equipment for IV cannulation ready. I'm going to apply the tourniquet to the patient's upper arm, making sure that I've explained to them the procedure and what they should expect. Once that is in place, I'll check for a radial pulse. Once that's palpated, I will look for a suitable vein to use. When I've chosen my vein, I'm going to wipe the site thoroughly with an alcohol swab. I'm using an upwards motion, just in the same direction, just to make sure that I don't wipe any dirt or anything back into where I'm going to insert the needle. So once that's sanitized, I'm happy with that, I'm going to remove the cannula from the package. When I do so, stating sharps out. Using my free hand, I'm going to stretch the skin away from the point of entry, aligning the needle above the vein at a 10 to 20 degree angle with the bevel facing upwards. I'm inserting the needle firmly through the skin till I feel a pop sensation as the needle enters the vein. Just checking for blood flow in the cannula hub. I'm advancing the tip in and sliding the cannula into the vein and releasing the tourniquet. Once that's done, I'll compress the entered vein with fingers near the tip of the cannula, withdraw the needle calling sharps out and sharps away as I put in the sharps container. So I'm going to cap off the cannula with a 3-way valve that should have already been flushed through. So I'm just going to screw that on. So once I'm happy that that's firmly in place, I'm going to cover the site with a dressing, just to make sure it stays in the position it is. Okay, and I'm just going to grab some tape. So passing the tape under the end of the IV cannula and looping both ends over to the opposite side, and then putting another tape over for good measure, just to make sure it's firmly in place if I want to put any medication or anything through the cannula. So making sure it's switched off, I'm going to be flushing it through with 5 ml of saline. So taking the syringe out of the packet and screwing off the lid of the saline, just checking that it's saline and that it's in date. So I'm going to pull down the plunger to 5 ml worth of air before I insert it into the ampule. So I'm just going to pull the plunger in and out and exchange fluid for air. So when I remove it from the ampule, make sure there's no air in the syringe, pushing the plunger gently upward if I need to make sure all the air is gone. So I'll unscrew that lid and leaving it upwards so that it doesn't get contaminated. I'll put the valve on and flush through the 5 ml of saline, just to ensure that my cannula is patent. We'll turn the valve off, remove the syringe and reconnect it back to the ampule. And place the lid back on.